Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work. Hi there, I'm your host, Lillian Liang Emlet, and I am joined each week by our incredible and diverse team of energy leadership coaches and guest speakers to bring you coaching perspectives to expand your awareness and inspire you to action. We believe that by empowering each individual within the healthcare community, we can create a ripple effect of positive change. I would like to introduce our team of coaches for today's episode.
Hi, I am Gillian Faith, and my healthcare experience comes from rehabilitation services as a clinician and also a clinical leader in both Scotland and the USA. I have also spent years in human resources management. I like to work with clinical managers, healthcare executives, and also clients who are experiencing overwhelm and stress. They may be dealing with conflict, or they may have important decisions or transitions to make.
Hello, I'm Grizelda Anguiano, mental health pediatrician and certified professional coach. My passion lies in partnering to empower parents as they navigate the joys and challenges of raising neurodiverse children, or as they themselves seek support for their own neurodiversity. Through a holistic and collaborative approach, I strive to foster resilience, understanding, and growth in families.
Hi, my name is Amy, life transition and career coach. From mind-body therapist to an ultrasound technologist, I've worked hands-on with thousands of clients. I understand the challenges of balancing work and self-care, especially in the healthcare field. We work together to ignite your inner motivations and line up your goals with your career and your personal life. Sometimes a simple shift is all it takes.
So, what does setting boundaries mean to you in the context of being a healthcare professional?
So, what's coming up for me with setting boundaries is just knowing as far as what are the hours that I'm going to be working. So, I think about the time it takes to prepare for a patient. When I was in the inpatient setting, it was like, when am I going to prepare? Am I going to prepare before I get to work? Am I going from home? Am I going to prepare as soon as I get there? But then the nurses start asking questions. I always found that having to find a little corner, little place where I can go to get prepared. And that way just sets a tone for the day, and I'm more intentional with that part of it.
And I think we're in a world, actually, I don't think I know, we're in a world where we're always connected and we're always on. So making conscious decisions about when you go home, are you going to leave your phone in the car for an hour to let everybody settle and have some family time that's uninterrupted? Are you going to just not look at emails until, it's now you're the next work day, rather than having endless alerts and emails, and where do you draw the line?
Another angle of setting boundaries in healthcare is really creating a limit or boundary on our emotional, our physical, and our mental energy, just to make sure we can still be that compassionate caretaker without sacrificing our own well being. So it's really finding that place where we can be there for the people we're working with and then also taking care of ourselves at the same time.
Yeah, it's so great. I was just talking about this the other night on call with somebody because someone had texted during the day shift to ask on me in the night shift how things were going. And you should be with your family. You should not be wondering. And you should be trusting that I'm taking care of things, and especially with shift work. When things are done, it's really hard to compartmentalize, but it's really important to make sure that you just allow each shift to be fully able to do their job. Because it sometimes feels like you're getting second guessed during different shifts when I understand that it's partly just really worrying and thinking. And the only way to satisfy that worrying and thinking about whether you did the right thing clinically is just to reach out and ask. But you'll be back the next 12 hours. You'll be back in 8 hours. They'll be all right. You'll find out as soon as you get back. It's like a mystery. The suspense is great. Boundaries are really important for healthcare professionals in general, and it really varies how people decide how to exert them or feel like they are empowered to actually uphold their boundaries. And so, what are really common boundaries that you think are actually important for healthcare professionals to become aware of so that they can actually provide great patient care?
Really learning good communication skills, I think, is really important. tapping in with what the situation is at a professional level, and then also what your personal needs may be as well in that moment. And that's where that area of creating that boundary and being able to speak to that, whether it's directly or in a way that the other person can hear, that you're going to satisfy taking care of your own self while you're also getting the job done.
And in healthcare, we're always giving. It's physically demanding, it's emotionally demanding, mentally demanding, and we can't pour from an empty cup. So we have to take care of ourselves. And if we do that, we can then continue to give to the patients that come into our care every day.
And I think what's coming up for me is the part of setting the boundaries that I'm here to do this part today, or I'm going to set this time to round. And that way I know that I can completely be present for the families at that point, but yet still taking the time to say, okay, now I'm going to have lunch. And even if, and not say you, so a lot of people like, oh, I didn't even get to eat lunch, or I didn't get to go to the restroom. And even I've always, one, because I get hangry, but it's taking time that let me eat. And I know filling, just the way Jillian just said, filling my cup, I'm so much more present for my patients and to be able to just think. So then I don't have to go back and second guess. Did I take care of that patient? Going back to the prior question, that it's, I can be more present.
I love that. I think it's so much of what you guys are both saying that it's awareness of your own self and just being able to just know yourself and uphold it. And for me, what I also see is knowing what your values are and also what your teams, other coworkers, and potentially the families or patients' values. And they don't have to be the same. And so just be realizing that a lot of times we talk about moral injury and the things that happen to healthcare workers, especially nurses at the bedside, whenever they're having to do care that is discordant for what they perceive their values to be. And at the same time, there's a realignment and a shift if you think about the fact that the patients and the family's values and the team's values actually are aligned. And even though this may not be what you would want, you're serving the greater good by doing whatever the patient, their family wants. And so I think just recognizing that awareness is key so you don't feel so trampled upon or so violated whenever you're in those situations, because that does happen to every healthcare clinician at some point, that this is not what I would do for my own body or my own self or my own family. And yet at the same time, we are not the other person. And so just the understanding that we have some boundaries, it allows people to be able to be themselves and make the better decisions. And you can feel that you're not violating your own values. I'm wondering, are there any strategies that you actually recommend or have seen in your clients that helps them establish really clear boundaries between work and personal life?
For me, what helps a lot is, yes, it's with my ADHD. And I also teach this to my clients and patients, is just chunking of the schedule, even if it's when is it my family time. And so that way I'm more conscious about either putting myself on focus mode versus now I'm at the office. And my family knows that if my phone is on focus, that means I'm with the patient. So they can send a text, and as soon as I'm done, I'm going to go back. But as soon as I'm out, I've seen a patient that'll take it off focus mode, and that way they know. And that way I don't feel the pressure of I need to respond, I need to answer. Is it an emergency? We have that set up ahead of time, but also just respecting each of those parts. And that way it holds me accountable to those schedules. So that helps that. And then also the family as well. I know it always gets difficult when we're on call, but also that way, again, that awareness and sharing that with the family.
Some of my clients find it really helpful to then switch into when they're home, just like in the ER when you triage a patient, what's most urgent, whereas what's something that can wait, right? You're doing this in the ER, also in their own life. Wait, is this really something that needs my attention right now? And is it something that maybe it doesn't and it's not that important? Either I can let it slide a while, or maybe I can even delegate. Really using that same model as you might do in an emergency room for your own life. Because some people I find will have not only their family, but a stream of other people that they're constantly just trying to help. And there's no time left for themselves. And the results of that really start to take an effect on them. So they find it helpful to think of it as like in the triaging.
So I have to admit, I'm actually probably an integrator in life. where I tend to do more than one thing in my day to day. And so I think I didn't discover this until I became a mom, where you really can't turn off one part of yourself as much as many people try to compartmentalize their mom time versus their work time. And there's some very strict boundaries about that. The reality is, it feels a little bit better to not have that. So for me, actually, and I love both the tips that have been provided already, because I love the triaging your life like you're in the emergency department and setting the focus time trick. I will definitely use that. That's such a great advice. For me, it's just about having some general tendency rules. 'Cause I'm also someone who, as soon as you give me a rule or a very strict line, I will want to cross it. So for me, I actually, instead of having these hard and fast rules, I have a general tendency that Mondays are generally for my daughter. So like things related to the business, to coaching, to clients, to my daughter is generally Mondays. Tuesday has a certain flavor and theme. Wednesdays through Fridays is all the academic clinical work. And so things have fallen into place. So there is a little bit of both, and also understanding that you can text me anytime. So there's a certain people that, like my daughter, she wants to text me anytime. That's totally okay. So some people, there aren't boundaries, because I don't want her to ever feel like I'm unreachable, even if I am at the hospital. And at the same time, understanding it might be a couple minute delay if I can't quite get to the phone. But surprisingly, I think when you first become a mom and you're working in healthcare, you wonder, how am I going to pump? How am I going to do all these things? And you can run codes and pump, believe it or not, at the same time. Although I think this next generation does have that capability. But I think people are always surprised at what they actually can do, as long as you have very thoughtful, deliberate presence. And this is why I think I anchored to gratitude and mindfulness practice so much, because you do have to channel that almost every couple minutes, right? To be able to reground and think about what you're going to do next. So I just want to close out. The last question is, how can healthcare professionals communicate their boundaries to their colleagues and supervisors? Because I think a lot of the time we feel a perception from our bosses are not supportive, or our own teammates are not supportive.
And what's coming up for me when you ask this question is, first of all, the awareness that yes, you need to draw a line somewhere to take care of yourself, and understanding and realizing that you are important enough to do that, and you need to do it for yourself and for your colleagues and for your patients. So almost giving yourself permission to say, I hear what you're saying, and I will get to that, but I need 5 minutes for myself right now.
Becoming aware, accepting it ourselves that this is really important to me, and knowing that it's not selfish. It really is for the better of the patient, the better of the hospital, the better of my own family. And if I know that is why it's important to me, then it's a lot easier for me to say, hey, you have access to me. I signed up for 9 to 5, but yet you're getting me 9 to 10. Okay, but this other time or on the weekend or however. But because especially in the hospital setting, and definitely when I was in private practice for in general pediatrics, I'd come home and still have hours of charting. And now my kids are older, but when they were younger, like, Mommy, how many more charts? Or when I'd walk in, like, how many charts? And I wish I knew then what I know now, as far as like having those office hours, that it may be let me either after they go to sleep, maybe just give myself 1 hour and not until I'm done. I remember charting when I was kneeling down, standing up, being so creative to try to get them done. But now when I have charts to do, I'm going to say, okay, let me get this done. And I'm going to put a timer for myself, and I'm going to come over here. But I think just telling others too, this is when I am available to cover an extra shift, or this is when I am available. That way it's still being, I can be a team player, but yet I'm respecting my own time and boundaries.
Now, if we take that time, we're going to come back more refreshed and be in a better position to get through the work faster or more efficiently.
I love that timer hack. And hopefully this next generation will improve with AI, actually hoping all of us with charting, hopefully live in the moment. There's so much of things that if only we could just do these live in the moment, that actually does help, hopefully with all editing of the note in general. For me, I think where the boundaries are with our colleagues, and whenever there's this immense guilt for if we get sick, right? So the pandemic taught us that it's actually okay for us to take the time, and especially with our families, and then to volunteer to be able to help each other. And I think that's the other hard thing, is just that process that some people can just pause for a second, see, and figure out what could happen. It's having a good working group to decide who's going to cover each other, because I think that's something we often find a little bit challenging is to our boundaries are being changed, right? Because we're not supposed to work, and that also keeping track so the group feels everything is equitable and really being transparent as a leader and praising everyone for doing the right thing. So I think a lot of times we don't hear praise from either each other and or our own bosses. And so I think that actually goes quite a long way just to acknowledge the sacrifices that people are making and being overt about that with the family, with the group. As we come to a close, is there any key takeaway you would want our listeners to remember about setting boundaries?
That it's okay, it's possible. As I've grown wiser, not to necessarily just say older, but wiser, it's keeping the boundaries. It's healthy. It's healthy for our patients. It's healthy for our colleagues. It's healthy for ourselves. And it is that win. And so instead of saying feeling bad for creating a boundary, it's just knowing that there is true value and then we all can win.
And I would also suggest using a buddy or a friend when explaining to them what you're doing and asking them to help you, to remind you or support you in taking the breaks or setting the boundaries, whatever it is. But having somebody that is on the same page as you that can give you a gentle nudge here and there, or maybe it's not so gentle sometimes, but so you'll actually do what you said you would do.
That's really awesome, Gillian, because you just reminded me in terms of this is why like-minded people find each other in terms of go to coworkers and colleagues and the wellness community and our Med Thrive community as well. Just finding like-minded people who want to actually support and uplift a different way of being a healthcare professional this day and age. For me, I think my whole thing is that boundaries can be flexible. I didn't know that. I literally revolt inside when I hear the word boundary. And yet I also recognize that I actually do have boundaries. They're just flexible. They're not very rigid. And so that people can actually begin to just practice and play with them rather than feeling like they're set in stone and this is how this family's going to operate kind of thing. And actually, you have to be a little bit malleable in general. Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. And we would love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey and join our email list to be the first to know about our coaching programs. We're also excited to offer the Med Thrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare one person at a time.